here with Zee Hussain, Senior Vice President of Global Business at AT&T, to talk about a modern team, this one being led by AT&T to expand healthcare capabilities beyond the traditional four walls of a hospital. Yes, we're talking about AT&T and healthcare, which may surprise some people. I'm super proud of Deloitte's long history of working with AT&T on a number of teams, including this one. So I'm thrilled to have you on to discuss this project, Zee.
Dan, thrilled to be here. Thank you for giving us the opportunity to highlight this great collaboration.
I love it. So Zee, why don't we start where probably some of the readers and listeners are curious, which is give us some background on AT&T's part in the healthcare space. I'd imagine some people may not be aware of how integral of a role that your company plays in the advancement, in particular, of virtual care.
Yeah, you're absolutely right. I think what I'm going to share right now is probably going to be a surprise to a lot of people. So, look, healthcare is a very important vertical for AT&T. Even though our marketing teams and sales teams in business today are fully verticalized, we're essentially segmented by industry. That was not the case about a decade and a half ago. This journey started with healthcare because we realized that if we want to be able to deliver the right outcomes for our clients, the healthcare institutions, the clinicians, the patients, we really needed to build an expertise in the specific vertical so we would understand the regulations that are impacting the vertical. So we basically built the AT&T healthcare vertical about a decade and a half ago. And at that point, our discussions were mostly around connectivity to the healthcare facilities and connectivity between the healthcare facilities. They started expanding into what solutions we could provide within the four walls of the healthcare facility. This has been an iteration. We've been, working very, very closely with the healthcare institutions around this journey for connected care. Last 2 years pretty much put everything on a significant acceleration path. As these institutions, as all of these different companies in the startup environment, as a lot of the larger integrators had to figure out how to deploy these virtual health, remote patient monitoring solutions out for their patients, they started reaching out to us. They started working very, very closely with us to figure out how does connectivity integrate into these solutions. As you would imagine, Dan, connectivity is an integral part of these solutions because you need to be able to see the patient, you need to be able to communicate with the patient. Another thing that really worked in our favor is the fact that AT&T is the provider for what is called FirstNet. FirstNet is essentially a first responder network with priority and preemption, and the government actually authorized the use of FirstNet for essentially for doctors and nurses who are the first responders in this pandemic. So our legacy within healthcare goes back a long time, and we've been very much immersed in the ecosystem in the last few years in delivering these telehealth and remote patient monitoring solutions.
So, your investment in healthcare goes back a long time. The relationship between Deloitte and AT&T goes back a long time. But in the context specifically of this push, particularly over the last few years, share maybe a little bit about the experience of how AT&T and Deloitte came together to formalize efforts on this initiative and what drove the urgency behind this for your team.
Yeah, absolutely. As you know, the relationship, and as you pointed out, the relationship between Deloitte and AT&T is long-standing. It's very unique. It has multiple dimensions in the sense that we work with you to help us run our business better. You leverage our connectivity to make sure your business and your employees are connected. The other dimension of this is that from time to time we get together and we say, how could we go and approach the market, approach our customers to deliver the right outcomes that they're looking for? We've done this, Dan, in the public sector quite a bit. We've done this as a smart city collaboration. You all also collaborated with us to bring 5G connectivity to your campus around here in North Texas to test some of the use cases around the future of work enabled by technology. So there's definitely a whole lot of precedence of us working together. What we found out as we were engaging with our clients in delivering these telehealth and remote patient monitoring solutions was that most of these were point solutions. And the idea here was to be able to make this easier for the patients, to make it easier for the clinicians. And what we started seeing was that in a lot of cases, the outcome was exactly the opposite. There was a lot of frustration from the patients because the video quality might not be bad, the platform might be really glitchy. You may have to make several attempts to be able to connect with the caregiver. Probably, the interface was not as intuitive. On the caregiver side, there were equal frustrations, similar frustrations associated with the platform, but then there were not a whole lot of efficiencies because they would have the consultation and then they would have to go interact with a lot of different systems to input that information. So what we saw then was this was causing a lot of angst and frustration and inefficiencies with our customers. And this is very near and dear to us because inefficiencies mean that it's not a good outcome for the patient. It's not a good outcome for the caregiver. They're taking a whole lot more time with these interactions, which means they had less time to go attend to other patients. And, in healthcare, these are life and death outcomes. What we saw through these interactions was that, there were some brands that were doing a fantastic job of delivering these outcomes the right way for healthcare, and Deloitte was one of them. What we saw was that your platform was integrated. It always thought about what the experience would look like. It removed a lot of the friction, and it was really, really easy for us to be able to incorporate connectivity to deliver the right outcome. So we saw that as a great opportunity for us to go to market together and be better together.
Zee, I think this whole series about modern problems and then the modern teams that solve them, you've done such a good job illuminating the dimension of modern problems, which is so many stakeholders are impacted by the situation and ultimately, therefore, by the solution. And in the case of healthcare, in the case of this particular solution, you're talking about governments, you're talking about first responders, you're talking about caregivers and hospitals, you're talking about the hospital systems themselves. And so that kind of modern problem, we think, deserves a modern team. And a modern team, as I know you believe, is a diverse team. Diverse in ways you can see visibly, diverse in ways that are less visual. I know personally, Zee, diversity is a big passion of yours. How, though, in this context, do you think about the importance of diversity in forming the team, the different kinds of representation that the team that we assembled together, and how that hopefully is helping to create better outcomes?
Yeah, no, absolutely. And I know both of us believe in the fact that diversity is not only the right thing, but it's also right for business. And I don't think you can find a better example than our collaboration over here. Look, we're a technology company. You all have tremendous technology chops. We can easily put the smartest people in the room to come up with best-in-class technology solution. But that technology solution doesn't mean anything if you don't have adoption, if it's full of friction, if the clinicians, the doctors, nurses, the patients don't see the value in it. So I think, one of the core principles for us coming together was to make sure that we look at this problem for all different possible angles. And for us, it was really crucial to bring a team that is not only really good in building a technology solution, but we wanted to bring folks that spend their day, sitting with these clinicians, going on the journey with the patients as they engage with the healthcare systems. We also wanted to bring in the product teams, the marketing teams, some of the folks that actually do the work with the hospitals, with the healthcare facilities on the ground. The outcomes were great. We started coming up and thinking about all of these solutions that all of these problems that we might not have extracted if we didn't have the diverse lens here. Let me give you an example. As we were going and building a solution for this problem, one of the things that came up was this whole notion of healthcare equity. So one of the givens was that when you go and deploy the solution, people will have connectivity at their home. They should be able to connect this to their Wi-Fi network. As we talked to different people that were at the table, they said, look, that is not a given. there are a lot of folks that we serve in these communities that have no access to connectivity. So connectivity needs to be embedded in this solution. The other element of it was around compliance, that, if it's a great technical solution, but it's really hard to operate, and you have to go and engage with it in a manner that's full of friction, it's not going to work. So really focus on the design element of making it as easy, as seamless to interact with as possible. So those are a couple of good examples, Dan, how we came about it from various lens and not only delivered the right technology outcome, but the right societal outcome as well.
And I love, Zee, that modern teams have agility. And your equity example is such a good one. You have a vision for a solution, and then you run into interesting the data that makes you think about the solution a little differently, and your ability to pivot and do so quickly becomes a hallmark of the team's delivery. And I think this team has done it well. Let's bring in Christopher Day, a senior manager with Deloitte and with my customer strategy and applied design team. Chris has been one of the integral leaders of this project with AT&T and the integral leaders of this modern team. Chris, thrilled to have you here.
Love it. Thanks, Dan. And enjoying the conversation so far. I think it's one of the pivotal problems we're trying to solve. So excited for the conversation.
So, Chris, talk me through the merging of the technologies and capabilities between Deloitte and AT&T. And I'm curious, was there an aha moment when you realized that these teams together could truly address one of the most important complex societal problems together?
Yeah, I think it's interesting. We're talking about modern teams and modern solutions, and actually we're facing a very legacy historic problem, and we are working and operating in healthcare, which is really built around this post-World War II construct. You deliver destination healthcare inside the four walls of a hospital. And that isn't really the modern way people or humans interact. Humans get sick outside of the 9-to-5 construct. And we live far from hospitals. We don't really enjoy traveling into a box to get care. And so to me, it's a very complex problem that requires complex solutions. And again, we have solved this in point solutions for the last, number of years. The aha moment here is really, no one stakeholder group can solve the end-to-end journey that we're challenged with. We are more than anything trying to transform an oil tanker, which is healthcare being 25% of GDP, and trying to transition that over time. And point solutions is not really, a solution that's viable. So to us, AT&T solving some of the more fundamental problems that are getting in the way of virtual health, things like connectivity, things like the way we interact from digital journeys, and that expertise that our AT&T colleagues bring to the conversation was huge. Bringing our multidisciplinary, I would say, multi-skill set teams that included healthcare providers, technologists, strategists, all of those together in that kind of collision of skill set, collisions of thought, really enabled us to have more of a 1 + 1 = 5 dynamic where we could move at pace. And, more, I would say, in the last 2 years, where we have seen the pace of change driven by COVID, I don't think it's acceptable for any of these organizations anymore to roll out, a 2 to 5 year virtual health transformation roadmap. We're now talking like days, weeks, months to enact change. And so we don't have time to build a roadmap that says, hey, let's worry about connectivity in 6 months from now when we get there. It's how do we solve it on Friday? Because we need this solution on Monday. And that pace of change, I think, was really the aha moment. We didn't have time to go and think in our silos. We really needed to come together as a collaborative.
Now, Chris, when you talk about the industry as an oil tanker, when you talk about the paradigm of 9 to 5 in a box delivery of healthcare, you're not throwing stones from afar. You were a product in the early parts of your career of that system as a registered nurse. And so I'm really interested in how, as you formed alongside Zee and the AT&T team, the actual team members and the approach to this issue, how'd you think about the different types of experiences you wanted to knit together? And then how did you keep humanity in mind, humanity of the caregivers who would ultimately use the solutions, the patients who would ultimately benefit from it? How did the team have that in mind as it was being comprised?
Yeah. And, yes, I'm a product of that environment. And remember the way someone like me was trained. We are drilled in a certain way of working. We literally learn in the 4 boxes, and we've got a process for everything. And so changing the mindset of someone like that is difficult, and changing the entire ecosystem is going to be even more difficult. And I think the point you get at, Dan, is that this is a multi-stakeholder environment. There is no way you can change it point by point. You've got to get all these different collaborators in at the same time. And I would say, think of the way we solve that. I mentioned this is a complex problem requiring complex solutions that requires multiple skill sets, and actually embedding healthcare providers, whether they be MDs or nurses or HCPs, into the way we design and roll out our solution was key to us. So I was an RN, we had an MD on our team. We worked with healthcare providers who are still in clinic today to try and get their input, because it's not just about activating a new channel. It's not really just about switching on a virtual health app. It's actually about changing the way physicians interact with patients. Can a physician now work in a virtual environment? Do they know how to go from data to insight without having a patient in front of them? Do they know how to actually have that empathy with a patient through video in the ways that they didn't need to before? And so I think it's more about, how do you incorporate that stakeholder as a key part of your transformation in the design and in the rollout, so that we can design around all relevant stakeholders? And, I think in the last decade, we've had a very strong perspective that, things are patient-centric. People, the organization needs to rotate around those needs. And I buy that. But I would say we need to rotate around all stakeholder needs for us to really enact long-term change. And that's really the mindset we've gone into this project with.
Zee, I'm curious. I'd love to get your reaction to those thoughts from Chris around the multi-stakeholder design process. Did you feel that connection to the actual caregiver and connection to the actual manifestation of the delivery of healthcare, those insights being present in the team as we went about the work?
Absolutely, Dan. I think at no point did we feel like we were designing a technical solution here. At all points, we felt like we're focused on outcomes. What are the outcomes that we need to deliver for this experience to be significantly elevated for both the patient as well as the caregiver? So that was absolutely something that was, fully embedded into all of our interactions and how we partnered together, how we collaborated together, and how we built this solution.
Perfect. All right. Before we wrap this up, I'd like to pose a final question to both of you. And the two of you strike me like most people that I spend time with who've dedicated a huge portion of their career to healthcare. They are dreamers of a future that delivers healthcare in so many more effective ways. So assuming you're a dreamer, and Zee, I'll start with you. What's the future for virtual healthcare and the role that leading organizations like AT&T and Deloitte can do to take part in and hopefully accelerate that evolution?
Yeah, I think the dream is that patient care is just fully integrated in how you work, live, play. It's not something that you have to think about. It's just basically integrated into the fabric of you living, and that could be just very simple prompts around what you're eating, how much you're exercising, how your sleep was, all the way up to some pretty deeper diagnostics or biomarker analysis or vitals analysis that would paint a picture of how your health looks like. I would say we could probably even take it a step further, where technologies like 5G and Internet of medical things all around you would enable you to address pain through distraction therapy with VR, AR, you'd be able to transmit your health data in a very much lower latency manner that can trigger actions much quicker than they take place today. So I would say that the dream is that all of our care takes place outside the four walls of the hospital, and then ultimately, when you've exhausted everything, then it goes to the four walls of the hospital. Right now, everything starts within that tanker, within the four walls, and it goes outside. The dream is that everything takes place outside, and then eventually, if absolutely necessary, it goes into the four walls.
All right, Chris, build on that pretty compelling dream that Zee articulated.
Yeah, and I love the question because it allows us to be a little bit bold. And I would actually be bold enough to say, I think that, the future of healthcare is not about virtual, it is virtual. I think we are going to be anchored in virtual first in everything we do. It's not going to be just a channel, it is going to be the channel. And I think that's going to change and really move us away from being a centralized, physician-centric, four-wall-centric model to more of a dispersed, patient-centric model, anchored in data, anchored in patient experience, anchored in, and I would say intentionally, consumer experience, because I think that mindset is changing very significantly. The one caveat I would have is, change is hard, and I think this is going to be a process. This kind of old school way of thinking where, the patient needs to know the doctor by name, the doctor needs to know the patient by name. That's going to be a difficult construct to break down. And I think, while we're seeing rapid acceleration, it's going to be tough to change the culture. But if I was to dream, I think we're moving very fast in the direction that is going to be virtual first, in four walls second, very much anchored in data-driven insights and personalized care. So pretty excited for what the future holds.
Well, Chris grew up as a general nurse, but when he's caveating dreams, he's become a little bit of a consultant in the decades that followed.
My skepticism.
Zee, Chris, such a pleasure to speak with both of you about the groundbreaking work that both AT&T and Deloitte are doing as part of a modern team. The dream is real, the dream is close, and healthcare will be better as a result.
Thank you, Dan. Agreed, and a pleasure.
Thanks, guys.